we would have given you blood.
Sure.
But the more current thoughts are you wait until somebody becomes symptomatic from their blood loss.
Yeah.
You know, you're probably right sort of in that area where you could be symptomatic, but it depends too.
I mean, shortness of breath would be a big indicator on that.
It is. That is a symptom.
Yeah.
You know, a lot of it depends on too if it's a change. You know, because people get used to things. You know, I mean, I've seen people come into the hospital and their hemoglobin is 5, and you just wonder how that's even possible. You know, but it's because it was a really slow change that they just acclimated to. You know, over time. Whereas if you have a normal blood count one day and then you bleed for some reason and your hemoglobin's down to 5 from 12, you're obviously going to feel that, right?
Yeah.
So I think we have some labs from, did you see maybe your primary care doctor a week ago or so?
Yeah.
They were telling me that they had maybe labs a week ago that were higher than where they are now.
Yeah, that, I'm not sure. He ran lab urinalysis, and they, this time they ran a little bit more lab work, but of course the doctor side seems to want a little bit more information. You know,
okay.
So.
Well, I'm going to take a look at all that, all the information I have access to. But if it's a change from where you were a week ago, I mean, you're right sort of on the borderline of where we would really be thinking that you might need some blood. Most people don't lose much blood from the surgery that you had, but of course if you start out in a low place and then you have surgery, we're always worried that you're going to be lower. So if I take a look at things and I feel like you need a unit of blood,
doctor, I'm willing to find out what's the issue.
Yeah, well, so unfortunately giving you blood's not going to help with finding out why.
I know that's not going to take care of the issue, but
let me go look and after I look at all your blood work that we have available in the computer system, then I'll come back and we'll talk about it again. But like I said, you're just right sort of on that borderline of when we would, especially if we can.
What other what's the word? But what other blood tests would indicate there's some kind of issue?
Well,
the creatinine has to do with your kidney function.
Kidney function, yeah. But people that have chronic kidney disease sometimes are anemic.
And everything like that.
Yeah, sometimes they're anemic.
Right.
And so I'm gonna look at all of that too. So have they ever taken a stool sample from you and checked it for blood loss?
No, but I had
you had the colonoscopy.
Colonoscopy this year, upper and lower GI done because I requested an upper, and there was no signs. A couple of years ago, well, say 6 years ago, I had 2 polyps removed.
Okay, and so they're just following those, but nothing new.
They were benign.
Now, have you been feeling weak?
I just know I can't do as much as I used to.
Yeah, okay.
And I used to be really reactive.
Okay, and the reason why you can't do stuff is because you get tired and short of breath when you try to do stuff?
Yeah.
He's had 2 major ankle replacements. So he can't walk. He can't really get any aerobic type of exercise. So he's pretty sedentary.
Okay.
In my opinion,
and that's something I looked at. Maybe it was the cause because I've just not been active, you know. And
that would be difficult to blame low blood counts on that.
Yeah, sure.
Yeah.
I agree. That's got me concerned.
Yeah. But you know, it might be hard because you have been more sedentary because of that. Recently, it might be hard to really tease out whether or not you're symptomatic from your level of anemia right now.
I'm an active person. I was.
You used to be, yeah. Okay.
What about the shortness of breath? Would that sedentary life cause that?
I mean, people can just get, when you're not as active, just an amount of activity that used to not bother you can just be much harder, and so you can be short of breath with less exertion if you've been sedentary, for sure.
I've been thinking about changing my internist at home. He became real sick at one time. He was a nice guy and had a bleeder in the brain.
Oh no.
And it slowed him down a lot, so I don't know if I'm getting the follow-up with him that I should be.
Well, and you know, aside from looking at your blood counts, and you know, if you were to have a bowel movement here, I'm assuming that our lab we could hemocult it, meaning look for microscopic blood loss. I think that's less likely to be a huge issue just because you've had a colonoscopy and an upper endoscopy recently, but that's always the first thing that I rule out is GI blood loss because it's the most common reason for anemia.
Yeah.
Have you started any new medications in the past several months, 6 months, a year?
No.
Have you been taking
Everything's
Motrin or ibuprofen or aspirin where you hadn't been taking that before?
I was taking baby aspirin, you know, every day in the morning.
Is that a new medicine for you, or?
No.
Okay, and you're not taking.
I've been taking it for years.
And you're not taking ibuprofen or Motrin or anything for pain.
No. I was taking leave, and we switched it to arthritis strength
Tylenol. When did you make that switch?
6 months ago.
Okay. Well, I think that probably we're not going to know for sure if some of these symptoms of shortness of breath and just general weakness and not being as active, if we're not going to know if it's related to your anemia, if it's caused by your anemia until we give you blood.
Why is that?
Well, if we give you a unit of blood and you're not as short of breath and you don't feel as weak, then it's probably some of that was related to your anemia, to having low blood counts.
See, sleep apnea, you know, I was doing that, and I haven't been doing a lot of it.
You haven't been wearing your CPAP?
No. It makes me claustrophobic.
Okay. Did you bring it with you?
No.
Okay.
And I wanted to get a new mask, nasal, try the nasal mask instead of a full mask. And just never followed through doing it.
Okay. Well, I'm going to go look at your labs. And if it's been a significant change from where you were a week ago with what your blood work looks like down to where you are right now, then we maybe a unit of blood is what we need to do.
Yeah, put it in me.
Okay. All right. Well, like I said, after I review everything, I'll come back and touch base with you.
I just, when he came in, I said, hi, Amy. I didn't know you from the past, you know. So I had PA is Amy.
Oh, really? Well, so am I. So you got it right. So that's okay.
Thank you. And just stopping you.
Do you need anything right